A very warm welcome to you once again to another exciting and insightful episode of Talk, Share and Inspire. And today we want to turn the tangent a little bit and speak about our health, our medical conditions, things that have been coming up, and just to see what are some of those things that you should check on in your own health. My name is Erica Okeyo. I'm going to be your host for this session. I discovered a very staggering statistics that I'd love to read to us. It says in Africa as a whole, lifestyle diseases among youths are a growing concern. Non-communicable diseases such as diabetes, hypertension, cardiovascular diseases, and obesity are increasingly affecting young people. You know, when I was growing up, obesity, hypertension, which I think is also called high blood pressure, were only common amongst people who are older. But those are now things that are affecting us as young people and even as Africans. So today I'm joined with a medical doctor. She is going to introduce herself. She's going to tell us about lifestyle diseases, things we should watch out on, and what we should do differently. So allow me to introduce to our set today, Dr. Nina.
Thank you very much.
Hi, Dr.
Hi, how are you?
How are you?
I'm fine.
Thank you so much for joining us today.
Thank you for having me.
Yes, we are depending on your knowledge to deal with lifestyle diseases.
I hope it's adequate for you guys.
Awesome. So yeah, you could probably introduce yourself.
Okay.
Yes.
So my name is Dr. Nina, Nina Kerubo. I'm a general practitioner. I practice in Nairobi. I'm based in Nairobi County, but I see patients in different hospitals. Yeah.
Okay. For how long have you been practicing medicine?
So I've been practicing medicine for 5 years since I
For 5
graduated in
years.
2019.
Okay.
Yeah.
Okay. Okay. Great. So yeah, Nina, I just want us to go right into the conversation.
Sure.
I read the statistics, and I want you to tell me from your experience, is it the same thing on the ground? Is it the same thing that you experience at the hospital?
So, yeah.
In terms of lifestyle diseases? Yes.
Okay, so lifestyle diseases are definitely on the rise amongst the youth. And like you said, Africans, I think mainly a lot of people think lifestyle diseases are associated with the whites, but with urbanization that's happening in Africa, even especially in Kenya, we do have a lot of lifestyle diseases. And the reason also is because of habits. We have sedentary lifestyle, like most of us are not very active. We're very passive in our motion, and then also in what we put in our bodies, in terms of diet and other things.
We're going to break that down. So you've said one of the causes of lifestyle diseases is urbanization.
Yes.
We have moved from like a rural setup
To more
probably
urban.
yes to more urban areas, so it's affecting first of all a sedentary lifestyle.
Yes.
And maybe just to explain, like if it's a sedentary lifestyle, maybe I'm working an 8 to 5 job and I'm always behind my computer seated
Yes.
the whole day. I leave my computer, I go to, maybe I'm using public transport, I'll be sitting.
Yes.
And then after that, I'll go home. I need to, maybe the only standing up, maybe I'll be just cooking.
Yeah.
And then after
Or washing.
that,
Yeah.
yes, or washing. Then after that, I'll be
Seated
sleeping.
and sleeping.
Yes.
Yeah.
And so that's my life 24/7.
Yes.
Okay.
And also with the urbanization, you have the introduction of smartphones. So these days you're scrolling. So you get home, you do your cooking, you're washing, and then you're on the couch like this, you're scrolling. You're on the couch, you're watching your telly. So most of us are not very physically active, and that also contributes to your lifestyle diseases.
Okay. Yeah.
Even when you're at work, most of us, you're working on your computer, you're scrolling,
Yes.
Yeah. So that contributes.
And I remember in one of the conversations we've had here at Talk, Share and Inspire, we said you're eating your own social, like you're actually doing 3 things at the same time.
You're eating and you're also eating, you're consuming social media. So that definitely contributes to some of our disorders. Yeah.
Okay. And so like from your experience, what are some of the common lifestyle diseases you've observed amongst young people?
So like I think just what you've mentioned, you have hypertension, we have type 2 diabetes. So there are different types of diabetes. Type 1 you see mainly in the young, and that's more genetic. But then you have type 2, which is now more lifestyle infused. Like you have you take a lot of processed sugar, you're eating a lot of fatty foods.
Let's break down processed sugar.
So the fizzy drinks, the processed sugar is the
fizzy drinks
your
like
sodas, your added sugar. Is one of us who likes a lot of sugar.
No, I'm just pointing the camera to anyone who loves soda.
I mean, I'm also a culprit. I try to cut down, but so many of us like sodas. You like the processed sugars,
like candy.
Oh gosh. gosh, yeah, I'm definitely guilty of that. I'm trying the candies, the chocolates. So yeah, that's part of the processed sugars. So that contributes to your diabetes. And you also have, like you said, heart diseases, kidney diseases. Yeah, so obesity, like you said, we see it in children these days. We also see it in adolescents normally. And I think most of the times when we think of obesity, we think of the other population, the Caucasians, but it's also with us currently. Yeah. And then we also have the cancers, which is quite unfortunate, but we are seeing an incidence of rise in the young people.
Okay. And now let's a little bit just about obesity. So when exactly can I say I'm obese? At what point?
So you have to do your BMI. So in that we check your height and weight, and then now we can classify you as if you're underweight, if you're of great weight, if you're overweight, if you're obese, and if you're morbidly obese. Yeah. So yeah.
So there is underweight.
Yeah, underweight. You can be of adequate weight, like normal.
Weight,
and you can be overweight. Then you can be obese. Then you can also be morbidly obese.
Okay. So obesity is different for different people.
I mean, it's not
Like
different.
I'm trying to imagine.
So like let me use you as an
yes,
example.
Yes.
So I think what they have done research, and they have seen that somebody who's of a certain height, like so we use your height and your weight to calculate it. So I don't know. You should never ask a woman about her weight. So
Yeah, I could tell you. I think I'm
at random. Let's say 70 kilos.
Yes,
So we expect a 70-kilo person to be a certain height. So if you're a certain height, like you're like 1.65 and you're 100 kilos, so that is not congruent, you know. Yeah, this is based on studies.
Okay.
Of course, part of there's still some debate in the medical community because most of these studies were done on the whites and the blacks. So there's some discrepancies, you know, but it's still what we currently apply right now.
Okay.
Yeah.
So yeah, obesity, I can.
So we use your BMI, your body mass index. Yeah.
So that's my height.
Your height. So we use your
weight.
weight and then we divide it by twice, like you multiply your height by 2. Like, yeah, time your height by 2, then now we calculate it, then you have ranges.
Okay.
Yeah.
So for instance, what causes obesity? Is it still the same?
Definitely a lot of factors. You have genetic factors, but a majority of contribution is also lifestyle factors. We do have medical conditions that also cause obesity. Yeah, so I mean, before you just pronounce somebody as just being morbidly obese, you have to investigate further. Like, is your family heavy boned, and then also to check how your lifestyle is, and then also some medical conditions, PCOS in women can give you extra weight. If you have hormonal imbalances, you can get extra weight and the likes. Yeah.
Okay. So yeah, we'll go to that part as we speak about reproductive health.
Yes.
But I'm just imagining candies, sweets, a lot of fatty foods.
So
do those ones contribute to obesity?
So there are many carbohydrates.
Chips.
Yeah. Oh yeah, the fats. I mean the chips, the fried chicken, the pizza, that definitely contributes a large chunk to our lifestyle disorders, and obesity is one of them. Yeah.
Okay. And I'm just interested to know, is it like you've said, for instance, you are trying to cut down?
Yes.
And I want to know, like, at what point should I say, now, this is a lot, this is more than moderate?
So the problem with most of our processed foods, they also do have an addictive component, you know, so your body gets used to the sugars. Then there's a dopamine pathway in which I don't want to go into
go there. Just go there.
Theories of it. So there's a reward pathway for your body. So your body likes a certain thing. So sugars, actually, processed sugars have also been shown to be as addictive as some of the drugs that we talk about, like the cocaines and the likes, you know. So there's a reward pathway. So it's the dopamine in your body. So when you take the sugar, your dopamine becomes quite high. So you become very happy about it, you know. And then, so your body looks forward to the next time that you're going to, so that's how actually like some of these hard drugs work, like cocaine. So you take cocaine, your dopamine increases in your body, and then once the drug has reduced in your system, the dopamine goes down. So you want to keep the dopamine levels elevated at a certain time. So that's the same thing that processed sugar does. So you take it, it increases the dopamine in your system, and then after that, you look forward to the next time you'll drink sugar. Okay. The next time you'll drink the soda. Okay. Yeah. And
so that's why you can easily find yourself like addicted. Having soda every day.
Yes, it has
having
an addictive
candy
component.
Every day.
Yes, the
every time you feel like, you know, anytime, let's say like after breakfast, that time, like during, you just want to snack on chocolate.
Quick snack.
Yeah. Oh yeah. And we're learning like progressively those things can lead to diabetes, hypertension,
kidney
and stuff like
disease,
that.
heart diseases,
Okay.
yeah.
Okay.
And I think part of the complication of some of these lifestyle diseases is that, especially like heart and kidney disease, most of the times you don't get to know them until you're end stage, until you're on the edge of it, until you're severely sick is when now you discover you have some of these diseases. Yeah.
Wow, that's quite sad.
Yeah.
Yeah. And then now I want us to also like talk about reproductive health.
Okay.
Because the angle of some of those, how do I put it, some of the diseases that have been like very prevalent amongst young people when it comes to reproductive health. So what has been your experience? What are some of the things you have noticed?
I mean,
for women and men alike.
So like for women, I think like what's been on the news since last week is the passing of Njambi, okay,
Kukai,
and she
yes.
had like endometriosis. So that's one of like reproductive health issues that women face.
Yeah,
And
could you just like probably for a minute break down what endometriosis is?
so ideally so your uterus, so for women, we have uteruses. So your uterus has different layers. So endometriosis is one of your uterine layer grows beyond, like it shouldn't be where it is, So you have, I don't want to, the biology of it maybe, but you have different layers in your uterus. So there's a layer that's usually shed, like at the cyclical, so that layer can find itself implanting in other areas other than where it's supposed to be, like the endometrium, that's where it's supposed to be, but then it can implant itself in your kidney, like for her, in your lungs, in your teeth. Some people are complicated in your brain, in your abdominal wall. So that's the complication of endometriosis.
Is it genetic or is it also attributed to lifestyle?
As we find, most of this reproductive diseases tend to have more of a genetic component.
Okay. Apart from endometriosis, what else? I've heard you say PCOS. What is PCOS?
So that's
polycystic ovarian
syndrome. Yes.
I've been reading.
Doctor, they should confer you the title.
I'm a Google doctor.
It's okay. We welcome you to our profession. So polycystic ovarian syndrome affects women. So it's your ovary has like extra cysts that shouldn't be there.
So and then it means we all have, like every woman has
you have
cysts.
So we have physiological and pathological cysts. So every woman might have a physiological, like a normal cyst, and then that depends on the measurement and the likes. So polycystic is you have too many of this, like you have too many cysts in your ovaries. So your ovaries become bulky, and then your ovaries are responsible with some of the hormone production, so that also becomes weary. So you also have like dysregulated hormones in your body and the likes.
Okay, wow. So there's endometriosis, there's PCOS. How about men?
So for men do have reproductive health issues. The testicles, they have testicular cancers and the like. So
so there's more of like cancerous.
Yes, I mean, sadly, we don't focus. Reproductive health is mainly because women don't get a lot of say in reproductive health, so we tend to focus more on what women are suffering. But men do also have. So most of them is testicular nature. I mean, that's the appendage, but you also have the penile cancers and other dysfunction in that area.
Okay, right. Now that we have that knowledge, I just, addressing a young person, at what point should I start caring about my reproductive health? Like what signs and symptoms should I watch out for? If I see this is the time to actually go and see a doctor.
So for women, in terms of reproductive health, so women have menses, it's a normal thing, it's a regular thing, but you do have abnormalities in your menses. So if you find yourself having heavy bleeding, like you're using 4 to 5 or more than 5 fully soaked pads during your periods are
that
lasting...
That is in a day?
Yes, in a day. Your periods are lasting...
Normally should be like around
3 to 4, but it also depends on a person, also depends on what stage of your menses are. Beginning, you may choose 1 to 2, then in the middle, you may choose 3 to 4, then as you're tapering off, you might also reduce to 1 to 2.
Yeah,
but
that's
some
my
people
experience.
Exactly.
Generally.
But some people tend to use, you can use 5 to 7 soak pads, 8 to 10 in a day.
Okay. So that's
They're fully
alarming.
soaked. Yeah, so when you have abnormal uterine bleeding, that's alarming. When your periods are longer than normal, so for normal people 5 to 7 days, we have those ones who have 3. We tend to say they're God favorites,
those ones.
Yeah, God's favorites, But then, so normally 5 to 7 days. So if your periods are longer than 5 days, that's abnormal. We have cramps. Women have cramps during our periods. But most of us, when you take some medicine, a paracetamol, ibuprofen, it's able to take care. But for some women, they need polypharmacy. You've taken your paracetamol, you're still feeling pain. You've taken your brufen, you're still feeling pain. And then it's affecting your daily life activities. Like you can go to work, you can go to school. So that would be a reason for you to probably want to seek medical help. Yeah.
Okay, awesome. How about men?
I mean, men should also feel themselves, like their apparatus. When they go to the bathroom and they're showering, they should be able to see if they can feel a lump in their testes, if one testis feels heavier than the other, if there's skin discolorations around that region. That would be reason for concern for the men.
I love that. I didn't know that. So if you feel like if you observe that one of your testicles
heavier than the
other, that is alarming. If it's also discolored,
some discoloration around your skin, so your testes tend to have some rugae, so some discoloration around there, and then if you have any masses palpable in your testes, so we don't normally concentrate so much on men, but men are actually affected by also reproductive health organs. Another thing, the breast is also classified as a reproductive health organ, and that affects both men and women. So the knowledge out there is breast cancer is just for the women, but we actually do have
breast cancer
for men.
For men,
yeah, men also do get breast cancer.
Tell us about that.
So it's the same thing. So it's literally just the same thing. You should be we advocate for self breast examination for both the women and the men. So you just divide your breast into 4 quadrants, and then you just feel. So you can do it I wouldn't advise on a regular, but maybe when you feel there's any outlier, you can just check if you feel for any masses, if you see any skin discoloration, retraction of your nipples, any abnormal discharge from your nipples, because most of the times when you have discharge in nipples tend to be lactating mothers. So any abnormal discharge from your nipples, so that would be a reason
retracting nipples. What's that again?
So your nipples do come out like this. So if you find that they are I really don't like inverted. Women do have inverted nipples, that's normal. But so if for me, I normally have inverted nipples, that's fine. But for somebody else, their nipple might be out coming. But if they do notice that now it's starting to retract, then that's a reason for
So it has always been outside. Let me just
Let me choose what it is. Like your nipple is outside. So so you're noticing that it's starting to, so retract is just to go back, So you're noticing that the way your nipple is not normal anymore. It's coming back in. That's a reason to get checked. Skin discoloration, any masses, ideally we should just be more in tune with our bodies so that you can be able, for men and women. So men are lucky because most of their organs are external. Women are not so fortunate, but for the women, you see, like we've talked about how to check on your menses and the likes.
So thank you so much for those very elaborate signs that I can actually observe. Things that are observable on your skin that you can check out on. And then let's also talk about access to healthcare for young people. What do you think are some of the barriers?
I mean, sadly, the biggest barrier tends to be finances, so you don't have your health insurance. I mean, you're a young person, you're hustling for yourself, so you don't have money, or whatever little money you have, the serikali na finya kabisa, so they don't have
pay like lots of taxes.
Yes, a lot of taxes, and then you have a lot of bills, so you tend to prioritize that over your health. You're like, you know what, I'll get seen the next time, because you don't have money and nobody can fault you in that. So that's one of the barriers.
So there's finances. Let's say I'm at the point of maybe I've noticed something and I need to seek medical advice and stuff like that. But then let's get to the preventive, because something like I noticed something like diabetes, hypertension, and stuff like that. Those are things that we can prevent. So what are some of the steps you recommend that young people should watch out on?
So in terms of for you to prevent, so lifestyle actually. So like you said, these are lifestyle choices. So lifestyle diseases. So if we modify, so for some of actually even for hypertension, there's a class when we grade it like type 1, we can actually advise you first to do some lifestyle modification first before we can actually start you on medicine. So we ask you, don't drink any alcohol. If you're smoking any tobacco products, don't do that. If you are heavy on the added sugar, like chakula ina taste kwa meza alafu unaongeza like a lot of salt.
You feel like you need to add more salt to your food.
So excessive additive of salt is also bad for hypertensive disease. You see.
You know why that is interesting? I'm just like thinking about, I was going to call them snacks. Are they snacks?
Exactly, yes.
Yes, like for me, I've noticed like the snacks that are look at chips, French fries.
Yes.
It has oil, and then I'm going to add salt.
Yes.
And then I'm going to add tomato sauce.
Yeah.
Tomato has
Salt
like
again.
it's tangy, so it has like salt and sugar. Yeah, so
So even
very
just
dangerous.
even the packet of chips that you're opening, they are very heavy on the sodium. So that's, I mean, salt is basically just sodium, you know. So the packet of chips the packet of crisps that you're eating, and then especially those ones with nice flavors, you know, yeah, like those flavors, salt and vinegar, your barbecue, tangy tomato, all those are additives, and most of those additives contain a lot of extra salt and oil. Yeah.
Okay, I love that. So let's pivot back to that point of checkups. How do you recommend, how often should I go for checkups? Let's say I'm checking out for example, I've had so many times when I hear people have been diagnosed with cancer, they say it's too far gone.
Yeah.
It's in their stage 4. If it was diagnosed
Earlier,
early.
yeah.
So how often, let's say for example for breast cancer, both for men and women?
So like we said before, you can do the self-breast examination. You know, you can do it. Maybe I don't think the reason I tell you not to do it every day is because, you know, even for women, our breasts tend to change during your menses, you know, and the likes, yeah. So, and then there's a risk of you becoming hypochondriac, like something small happens and you're like, is this cancer? Is this cancer? So
Yes,
so that's why we don't, but you can do it maybe monthly, every twice monthly. And then medically, the recommendations, for ladies below 35, you can do breast ultrasounds if you find anything pathological, and above 35, you can have a mammogram done, you know.
So above 35?
Mammogram.
You can, if you can afford it.
Yeah, you can get
go
a
to
mammogram
hospital
done.
and ask for a mammogram.
You can ask for mammogram, yeah. So the good thing with most of this, like we have breast cancer month, we have cervical cancer month. So most of our hospitals, both public and private, tend to offer programs. You know, the privates tend to offer screening at a subsidized price, and the publics tend to offer free. And then you also have medical camps. So some of Africa Cancer Foundation, even the previous one for the previous lady, Margaret Kenyatta, what did she have?
Linda Mama?
No, Linda Mama is a program for women in hospitals. So she had a program where they would, I've just skipped my mind. So they'd have medical camps. So during those medical camps, most of us health professionals volunteer our time. So when you get screened, so you can get your cervical cancer screening, you can get your pap smears done, you can get your examination, just normal examination. You can have a self-breast, and then we also clinical breast examination. Then we also teach the men and the women. So that's something to look out for in terms of preventing VATEMs. So some of those medical camps tend to help us. Yeah.
Okay. One of my most favorite verses, the verse that says that God desires us to have life and life in abundance, right? And it goes without saying that I was going to use multisectoral approach.
As it should be. Yes.
So what are some of the multisectoral approaches that you think we can incorporate, maybe as a school, as a church, maybe coming together as schools, churches,
so like
community?
For the Adventist church, one of the things I like about us is like beginning of camp, so we tend to have, like on the first day, like on the Sunday, we tend to have medical camps on that day.
So people should attend medical camps, take advantage of
when the church,
things.
so most of the times we advocate for public-private partnership, or like you were saying, multisectorial. So when your church announces that there's a medical camp and you have a medical issue, you should come, because you get almost free access to healthcare. So you'll find me seated somewhere with a lab coat, and I'm talking to you, and you're telling me your woes, and I can advise you on where to go. So medical camps for schools, a lot of educative programs also for the children, you know, just something like basic hygiene. You know, if you teach a girl about normal menses, then she'd be able to know her menses are abnormal, then she can talk to her mom, or she can talk to her teacher about that, you know. So some of this, like reproductive health, should also be integrated into some of our educative programs.
Okay, I love that, you know, just finding ways of, I feel like sometimes our biggest problem, or why things become really bad, is we don't start we don't start small.
While we're young.
Actually, I was going to say when you're young, or we don't start small. Like if we'd started small with kids, just giving them like those things of basic hygiene. I remember during the COVID pandemic, that's when we actually started taking washing hands seriously,
and
which is very sad.
And do you know, in hospitals, we actually saw a decrease in diarrheal diseases, and Yes,
because of
diarrhea
washing
is a
hands.
fecal oral. So if you wash your hands, if I've touched somebody who has an infection and I've washed my hands, I've literally washed away the pathogens, you know. Yeah.
Wow.
So something as minute as just public health programs like those ones, yeah, tend to also benefit.
Yeah, so it's like would want to have it wholesomely. So we start with the young kids, start with basic hygiene practices. As adolescents, you know, the older you grow, now you have money, you can afford your chips and things
Yeah.
like that.
Yeah, so
we get them, we start to raise awareness. We tell them how these things are not, like, this should not be your first choice. I
Yes.
think that is one of the most concrete advices I
Yes.
had when it came to how to incorporate, like when you want to deal with lifestyle diseases, how to start cutting down.
Yes.
Let's say I'm hungry, okay, and I need sugars. Sweets should not be my first option.
reach for an apple.
Yeah, let me reach for an apple, let me reach for a banana.
Banana,
yeah,
yeah.
it's going to give me energy very fast.
Yeah.
So I should try my best. And then something else I've learned, find a way of having those healthy things around you more often.
Yeah.
If it's sweets, don't buy them.
Also, as parents, you
Yes.
should don't offer them. As like your child is fussy, the first thing you offer is a snack. You know, you are reinforcing in the child that this is, you know. So when you offer the snacks so often, you're reinforcing. So it's very hard for you to withdraw. You know, kama mtoto ashazoea, you know, the child is so used to eating crisps when they come back from school.
Oh, yes.
So this day we decide to give them an apple, they'll be like, where's the crisp?
What happened to
What
the
happened
crepes?
to the crisps? They'll take it today, but after a few days, they'll be like, what happened to the crisps? So ideally, if you offer the healthier option first, then your child does not develop that habit of wanting to eat the processed foods. Yeah.
Awesome. Thank you so much, Dr. Nina. That was very insightful.
Thank you for having
You've been
me.
very practical. You've given us the signs. You've told us things to watch out for.
Watch out for.
And you've not left us without hope. You've told us what
for
to
sure.
do.
Prevention is always better than cure.
Yes.
So if we can get ahead of some, and for lifestyle diseases, it's the answer is in the problem. It's a lifestyle disease. So if you edit your lifestyle, there will be no disease other than for those who are unfortunate to have other genetic components underneath them.
Awesome, awesome. Thank you so much, our viewer. I hope you take this as an opportunity to reflect on how you've been living your life and the few things that you can change here to allow you or to help you have a life in abundance. Thank you so much, and see you once again in another episode of Talk, Share, and Inspire. Bye-bye.